Thank you for joining my clinical documentation in-service training. The current Medicare conditions of participation guidelines are as follows. Compliance with the federal, state, and local laws. The standards are federal laws and licenses for state and personnel licenses. Under a governing body, the standards are medical staff, chief executive officer, care of patients, institutional plan and budget, contracted services, emergency services. Under medical staff, the standards are composition of the medical staff organization and accountability, medical staff bylaws, and autopsies. Medical record services, the standards are organization and staffing, form and retention of the record, and content of the record. Nursing services, the standards are organization, staffing and delivery of care, and preparation and administration of drugs. For quality assurance, the standards are clinical plan, medically related patient care services, and implementation. For pharmaceutical services, the standards are pharmacy management and administration and delivery of services. For radiological services, the standards are the services, safety for the patients and the personnel and records. For laboratory services, the standards are adequacy of laboratory services, the management, personnel, blood and the blood products, proficiency testing, and quality control. Food and diabetic services standards are organization and the diets. Utilization review is applicability, composition of utilization review committee, scope and frequency of review, determination regarding admissions or continued stays, extended stay review, and review of professional services. These are the 7 criteria for high quality documentation. The first one is legibility. Whatever is written in the medical record must be able to be read by everyone. If people beyond the physician and his staff can't read the record, mistakes can be made. A complete record will identify the patient, support the diagnosis, justify the care, document the test and the results, and promote care among the providers. Medical records have to be clear. If they are not clear, a coder will initiate a query. Clear records ensure timely submissions and also lessen the chance of fraud. Being consistent ensures that records are done in the same way every time. It is important for a physician to be precise. If the document isn't precise, the insurance company could deny the claim. If the data is reliable, it can be assumed that it is also valid. All data must be put into the record in a timely manner. This ensures swift patient care and swift claim processing. If documentation isn't done right, it can cause loss of revenue or cause patient errors. If done right, it can increase revenue and increase favorable medical review decisions. In the coding world, there's a statement that says, if it isn't documented, it isn't done. And if it's not done, your reimbursement can be affected. CDI will thoroughly review health records to ensure their accuracy. HIM professionals will support physicians by showing them how proper documentation helps everyone. Thank you for joining my lecture. These were the references that I used today.